Unfortunately, after bariatric surgery like a sleeve or a gastric bypass, a few patients can have recurring episodes of dry heaving or retching after they eat or after they drink. They may bring up what they just ate or what they just drank, or they may not bring up much of anything and just kind of some slimy, white, foamy fluid. My name is John Pilcher. I'm a bariatric surgeon in San Antonio, and I'm going to try to explain a little bit about what's going on here and what we do about it. So this problem of what we call foam emesis or slimy phlegm emesis is very uncommon actually, and it's a little more common in gastric bypass than sleeve, still being uncommon overall. And it represents some type of problem with the way the stomach and the little pouch are healing. The first thing is, if this is happening to you on a recurring basis, you need to be in contact with your surgical team because they're going to want to change plans for you. And I'm going to present some kind of general guidelines of what I tell my patients in this situation, but that should in no way get in the way of you being in contact with your surgical team. And then also, if you're having actually green bile emesis, throwing up large volumes of greenish fluid, that could actually be a surgical emergency, and you've got to be in contact with your surgical team. Stop watching the video and make the call if you're having the green emesis or the green vomit. Okay, now, for those of you who are still with me, what's going on here? Well, first of all, you're not crazy. This can be kind of a weird seeming thing because you swallow, let's say, a little bit of food and you're maybe 2 weeks out from surgery and it's some eggs, and last week they were fine, but now it's a problem, and you have a little bit of egg and you feel terrible and it's pressure and pain and nausea, and then you're heaving and the eggs don't come back up, but just the slimy stuff. And what it is this slimy fluid is a sign of irritation in your little stomach pouch. And for a moment, just think about if you get a little thing in your eye will make lots of tears to try to clear out that irritant, right? And so if your little stomach pouch is not healing correctly, and if it has some irritant, which is either the food or the fluid, then the little stomach and the esophagus, and actually all the way up into the nasal passages, has the same ability to make excess fluid, like the tears, to sort of try to flush this out. But unlike the tears, which are very kind of thin water with just a little bit of electrolytes in them, the fluid that's made by the stomach and the esophagus is more mucusy, more like snot actually. And so let's say these eggs are getting stuck a little bit from irritation or some problem in the stomach, and they're going to sit there, and the body's going to make lots of fluid, and people often feel a runny nose, or they feel a sense of pressure, the retching and heaving, and eventually this stuff comes back up. It might be eggs, it might not, and the pressure settles down. So this may represent just a kind of a mild healing abnormality, or it might represent an actual blockage or a more serious problem, and that's why, once again, you need to be in touch with your surgical team. But pending that contact and pending the change in plans, I think it's fair to talk about a few things to help you feel better, overnight or over the next couple hours while your team is working to engage. And the first thing I would say is stop trying to eat food in that moment. And food matters. You need nutrition, but food matters over a week-by-week and a month-by-month basis, and food is a little bit of a stress for your stomach pouch. So be gentle and be relaxed for your stomach pouch. Fall back to just fluids. And even fluids, I would give it a couple hours before you try drinking again, because once your stomach has been through this kind of traumatic process of heaving and retching, it's pissed off, it's irritated a little bit, and it's going to take a few hours to settle down. So maybe you let it rest overnight, maybe you let it rest like 4 hours, but you give it a little bit of time before you try drinking again. Now, hydration is important, and if it gets to be overnight and you're still not hydrating well the next day, you should be in contact with your surgical team. Maybe head to the ER associated with the place that did your bariatric operation. Do not let yourself become dehydrated. The next thing that I often recommend to my patients is some type of acid blocker. I happen to like Pepcid, which is over the counter. I don't own stock. I like Pepcid over the counter because it's cheap and it's a tiny little pill. It's easy to swallow. Very often surgical teams will recommend a prescription acid blocker, and the purpose of the acid blocker is, again, to block every little bit of acid in there to help soothe and to help things heal. Definitely follow the advice of your surgical team on this. You may take a break on your calcium supplements. Calcium is a little bit of a load for the stomach. On the other hand, it's really important that you keep taking your multivitamins somehow, because the multivitamins are important for avoiding nausea. Let me say that again in a different way. If you miss your multivitamins and you become deficient in some of the vitamins, that can cause nausea, so it can be a self-replicating thing. If there's any question about whether you're tolerating your multivitamin, get into contact with your surgical team so they can make a plan. Now, your surgical team is going to consider several other things. There may be a place for doing some studies or some backup plans. Backup plans might include arranging for you to get IV fluids. That might be done at a facility. It might actually be done at your home. The IVs can be used to give you vitamins if this turns into more of a prolonged issue. There might be a place for doing some testing, perhaps an endoscopy with the scope, or perhaps an X-ray swallowing test called an upper GI, or perhaps a CAT scan. Those would be commonly organized tests. Okay, so bottom line. This white foam emesis is a sign of irritation coming from a variety of potential causes, which I did not discuss and I'm not going to go into. And the immediate way to try to adapt to this is to give your little stomach pouch a break and to try to let it relax. But it's very important for you to be in touch with your surgical team, because recurring episodes of this kind of white foamy emesis are not expected, and they indicate that something is not on track. Okay? Oh yeah, one more thing. You will get better. Having this happen to you does not mean that you've wrecked your life or wrecked your body or wrecked your stomach. And depending on the exact circumstances in your case, this may get better in a day, a week, a month. I'm not sure, because obviously I don't know your circumstances, but it will get better. You stick with your team and follow their instructions. Okay? Stay well.